Well, welcome to today's talk. It's Wednesday, the 25th of March. And I guess, like me, wherever you are in the world now, your lifestyle has changed. And we have to accept that life is going to change for the next weeks, if not months. It's what we have to do to beat this virus. So we're all in it together. We're all in the same situation. I think we're all feeling the anxiety and the stress and the practical difficulties that are now coming. Now, well over 400,000 confirmed cases in the world now. Nearly 20,000 deaths and 111,000, nearly 112,000 patients have recovered. Always good to notice the recovery. But things are accelerating. Now, the World Health Organization have been saying some interesting things lately, so I'm just going to give you a bit of a review of that as to what the World Health Organization is saying. Now, they've teamed up with FIFA to do some sort of double act, which I suppose is good if it reaches young people or any people, that's good. And what they came up with was hands, elbows, face, distance and feel. So nothing particularly new, really. Keep your hands clean. They are advising sneezing into your elbow, which I think is quite unpleasant. I prefer to sneeze into a tissue. Not touching your hands with your face. A social distance of 1 metre. I think 2 metres better, as we looked at yesterday. 2 metres distance determines your existence. And if you feel unwell, to socially isolate. So that's what the World Health Organization and FIFA came up with. Fine, nothing wrong with it. Right. Now, the pandemic is accelerating, according to Dr. Tedros. Now, this is quite alarming, to be quite honest. He says 167 days from the first reported case to reach 100,000 cases. 167 days. Then to reach the next 100,000, it was 11 days. To take it up to 200,000. Then in 4 days, we reached the third 100,000. And I think we're up to the fourth 100,000 now, as we've just seen another 2 or 3 days. So 167, 11, 4, 2 or 3 days per increase in 100,000. This is an alarming rate of acceleration. But we're not helpless bystanders, Dr. Tedros says. We can change the trajectory of this pandemic, and of course he's absolutely right. Now, I used the analogy of Grey's Anatomy yesterday, attacking from above and attacking from below. So the World Health Organization is using the analogy of football. You can't win a football game by only defending. You have to attack as well. So what he's saying is the defence is this lockdown strategy. We're defending ourselves against the virus, which is great, but we also have to go out there and attack it. So how do we attack it? Listen, testing every suspected case. Every suspected case. Isolating and caring for every confirmed case. And tracing and quarantine every close contact. So every occurs 3 times there, testing every case, isolating and caring for every confirmed case, and tracing and quarantining every contact. This is what they did in Korea, and it did seem to work. And this is what the World Health Organization is advocating. So we clearly need millions of kits. Now, we are getting more kits, but the testing so far has been laughable, in the worst possible sense of that word, in many, many countries. So we have to attack it with testing, aggressive testing. We can't fight the enemy we can't see. So it's defence, suppressing it from on top, and attack, as I said, picking it away from underneath, which is the testing and the change in behaviour and everything that goes with the testing results. Quite a few infections in healthcare workers, which is concerning, and there's a world shortage of protective equipment. So solving this problem requires coordination, and he's talking to the G20, who have 80% of global gross domestic product. So really hoping that richer countries here step up to the mark and get this protection in place that we need, this personal protective equipment. Dr. Tedros says there's currently no treatment's been proved effective against COVID-19. Then he says small observational and non-randomised studies will not give the answers we need. Now, I agree. Saying, well, this seemed to work for that few patients over there, or this worked for me, therefore it'll work for you, is ridiculous. We need proper, big, randomised trials. And this is what the World Health Organization is doing in the Solidarity trial, which I'm going to give you some more details on because it's got a few difficult words in it. So at the moment, in the Solidarity trial, this is basically a group of countries that are getting together to do these clinical trials. So we've got Thailand, Argentina, Bahrain, Canada, France, Iran, Norway, South America, Spain and Switzerland. And there's a long history of these international trials in drug research. So this is good. It means you can get the numbers up quickly so we can find out what works quickly. We need speed and volume. And the rule of the game, he said, extending his football analogy, is to kick out coronavirus. And we all certainly agree with that. Now, a few things came to my mind recently. There's going to be direct and indirect people suffering from this. So the direct is the people that suffer from the virus itself, and the indirect is the people that are going to really struggle to get access to healthcare because people with the virus are taking up so much time of healthcare providers' time and resources. So distressing really to see that some cancer treatments have been postponed, a lot of elective surgery has been postponed. And we can't underestimate how distressing this really is for the individuals. I've had to personally give people information on quite a few occasions saying, look, I'm really sorry, but your surgery for tomorrow's cancelled. And it's devastating. Devastating. You have all the anxiety that goes with it. You have all the physical preparation that goes with it. And then, bang, you're not getting it. It's just terrible. So there's going to be a lot of that. And there is a lot of that at the moment. Now, in nursing for many, many years, when patients have chest infections, we know you don't lie them flat. Now, I don't know how this applies to coronavirus, but I was just thinking about this. So if patients have pneumonia or breathing difficulties, we always prop them up as long as the blood pressure can support the brain. So chest infections, for the last 40 years, I've managed them sitting up, not lying flat. So make of that what you want. We want plenty of fluids. Now, what we've always taught here, and I believe it to be true, that your respiratory tract is producing mucus, and these cilia, these hairs, waft up the mucus so you can cough it out. But if the mucus becomes thick, it's harder for the cilia to waft through this treacle-like thicker mucus. And if people are dehydrated, the mucus is going to get thicker, whereas if you drink plenty, the mucus is thinner and is more waftable. Waftable mucus is what we want. So plenty of fluids. I would advise drink lots of water. Also good for the kidneys as well. If you smoke, for goodness sake, stop smoking now. Let me give you one simple reason for that. Smoking paralyses the cilia. So instead of wafting away nicely, smoking will greatly slow the cilia down or even paralyse them. And the mucus and all the infection will just stay down in the lungs instead of being expectorated out. Now, I've had a few interesting emails on this, and this is just me throwing out this for interest. But we looked yesterday at the loss of the sense of smell suggested by some ENT specialists. And I've had quite a few people email me in from that and say they had strange variations in taste. So loss of taste, loss of smell. But things can sometimes smell or taste different. So interesting. We'll see if any data comes out on that. But the ENT surgeons were saying that loss of smell, even as an isolated symptom, should be a grounds for isolation. So really quite important implication from that. Now, the World Health Organization, this Solidarity trial, so we'll get big numbers up. So the thing in research is to get big numbers so you can extrapolate general principles. It's called deduction. It's kind of the opposite of induction. Induction is kind of, well, that red pill worked for me, so that red pill will work for you. That's not the way to get good quality evidence. The way to get good quality evidence is to say, well, that red pill worked for 10,000 people, therefore it's probably going to work for you because you are also a person like them. So that's what's happening now. And they are trialling what they must believe to be the best bets. So one group seems to be getting, one trial seems to be on remdesivir, which is the antiviral drug that was first developed for Ebola, I believe, which is another RNA virus. And then another treatment is a combination of these two antivirals. And I'm not pretending to be familiar with these drugs. I'm not. Lopinavir and ritonavir. So trying those two together, combination therapy by the looks of it. And then it seems like some people are getting those two and interferon beta, and some people are getting those two and chloroquine. Chloroquine we've used for malaria for decades, although a lot of malaria in the world is resistant to it now, but that would be good because it's easy to manufacture and it's dirt cheap. Now, this is a phone number that should be in everyone's phone. So if you've got a mobile phone, put that number in, text HI, H-I, to that number. And you will get back all the fascinating resources from the World Health Organization. So that should be in every mobile phone in the world, as we all keep up to date from definitive, as definitive as we've got, World Health Organization data. Okay, I haven't always been singing the praises on this channel, but they are publishing some very good stuff now, so get on to that. I would highly recommend. I think they've also got Facebook, but I'm accessing them on WhatsApp, and it works. You can flick through interesting information, and as we said the other day, life-saving information. There's a lot of mobile phones in this world. Let's get that information out there. We don't want anyone to die of ignorance. Right, the World Health Organization say the United States more than 51,000 cases in the United States. The World Health Organization say the United States is at risk of becoming the new epicenter. Very concerning. And I've just checked on the data from the United States, and what I found, it was 55,000 confirmed cases, and this is despite the severe lack of testing that there has been in the United States. As I understand it, half of the population is being told to stay at home. Now, the president's hoping this is going to be over by Easter. I do hope he's right. And the president believes that we're probably nearing the end of the outbreak. I do hope he's right. Unfortunately, I know that he is wrong. And I think every other informed observer in the world knows that that is not possible. Let's hope he proves us wrong. New York State, a lot of cases. 105 confirmed cases per 100,000 residents, which is roughly, I believe, where Italy is now in New York State. So Andrew Cuomo is saying that the numbers are doubling every 3 days. Governor of New York State. That is frightening. Do I need to go on? Bill DeBasio, if I'm pronouncing his name right, New York has appealed for ventilators. It needs many ventilators. I'm not sure these are going to come from central sources, so let's really hope that American manufacturing steps up to the mark as they have done in the past. Let's really hope they do. And I think it was Bill also said that people who've left New York should self-isolate for 14 days because it's a bit of an epicenter now. Now, talking to my friends in India this morning, in the north of India, everything's officially locked down for 21 days. Now, this is based on a sample size of 1, but my friends told me that there are still people going out and about in India. So difficult there because so often for about 600 million people in quite extreme poverty in India, what the family eats that evening is what they earn that day. So it's a remarkably difficult situation in India. But officially locked down for 3 weeks, that's 1.3 billion people. State borders have been sealed, the different states within India, and this is being enforced by Indian police. That must be the biggest lockdown of people in the history of humanity, I would imagine. Mr. Modi has been on national television to announce this and decree this, in fact. Not many confirmed cases, but you know about my anxiety about India, the way it could spread through crowded, poor conditions, really quite alarmingly. Now, Spain. Spain, 47,000 confirmed cases. Deaths increasing alarmingly. Really quite distressing. Temporary hospitals, ice rink being used as a morgue. Restrictions for over a week now. Now, to be fair, the increase in numbers of deaths and cases in Spain, given that the lockdown is only just over a week now, is not surprising me. Because a lot of those people that are getting the infection, and I think we could say pretty well all of those that are dying, the vast majority of those that are dying, contracted the infection from community spread before the lockdown. And we would expect the lockdown to take a couple of weeks to take effect because of the incubation period of the illness. So this is in no way an indication that the lockdown is not working. I would predict, quite strongly predict, that we would expect the number of new cases in Spain to start decreasing next week as the effects of the lockdown work through the incubation period. So if you're in Spain, please don't be discouraged. Well, we're grieving with you, of course, but don't be discouraged for the lack of hope, because I would expect the number of new cases to start going down next week, because this top-down defensive approach will work. It will reduce the numbers, and at the same time we need to increase the testing to pick away at these individual cases from underneath. We need more testing. Tragic story about the army finding one or more retirement homes where the staff had left. That was really quite distressing, that residents had been found uncared for, and indeed some had died alone. So distressing. Italy, great number of increasing cases, deaths increasing. Up to yesterday, I think it was day before yesterday, 601 deaths, 703 deaths yesterday. Again, tragic scenes unfolding in Italy. But the infections were contracted before the lockdown, so the Italian lockdown is starting to work because the new cases are falling. Now, there was a slight increase in numbers of new cases yesterday, but the percentage was falling. The percentage of new cases is falling. And this is great. It does show that the lockdown measures are starting to prevent new infections. I really believe the lockdown in Italy is now starting to work. And I would predict that over the next few days, the percentages of new cases in Italy will carry on going down as the lockdown measures prevents the transmission of the viruses. Lockdown enforced by police, and there's some great videos, you've probably seen it. Local mayors going round making their views to anyone who was breaking the regulations, making their views known in no uncertain terms, and some remarkably poignant appeals by local mayors for people to stay at home. One guy this morning says, "Don't you realise people are dying? What bit of death don't you understand?" UK. Increasing cases, increasing deaths, doubling time roughly every 5 days. I expect this to massively reduce now we are locked down. So the UK is now pretty well completely locked down, only essential workers going to work. Few exceptions yesterday, but they're being sorted out today. You're allowed out for essential food shopping, for medical needs, to care for a vulnerable person, or exercise on your own once per day. You're not allowed meetings of more than 2 people, and even then they must be 2 metres apart. 2 metres apart, and the only people that, apart from that you can walk out with, are members of your own household. So if there's three or four people in the house, they can walk out together, but meetings of no more than 2 people if they're not from the same household. And our best wishes go to our heir to the throne, Prince Charles, who is himself been diagnosed with COVID-19. And let's just say Prince Charles is a fair bit older than me, so this is not without concern. I wish him well. France, everything increasing in France. Again, the strict enforcement measures will start to work, and they are being strictly enforced now by French authorities. Japan, at long last, has cancelled the Olympics. That had become a bit of a farce that they were pretending that was going to carry on. Cases increasing in Germany. So the pandemic is accelerating. We need to attack it from the top with social isolation, social distancing, lockdown measures, and pretty well everywhere in the world is starting to do that now. What we're not doing enough of is the attack strategy from underneath, picking away from underneath with the testing. We need more testing to make this enemy visible. It is happening, and it can't happen soon enough.